Hi, my name is Helen O'Leary, and I am a physiotherapist and clinical Pilates instructor. My professional background is actually elite sports. However, I moved into private practice and started Complete Pilates in 2015 after finishing touring with Cirque du Soleil. Within the last decade, I have completed pink and steel cancer rehabilitation training and worked with multiple cancer survivors as well as those diagnosed. This subject is really close to my heart, as I have had several very close family members and friends diagnosed with cancer. I wanted to help with not only information, but also keeping them moving safely through their treatment and beyond. So today, I'm going to take you through some of the best Pilates exercises for breast cancer recovery. The exercises you need will be individual to you, your goals, your body, and your stage of treatment for breast cancer. To establish this, a one-to-one clinical Pilates session is a great way to make sure you start in the right place for you. However, the below exercises are an example of things we may work on to make sure you have good range of movement and muscle strength through your shoulder, spine, and the rest of your body. Please do feel free to give these a go, but remember, they should never cause you any pain or discomfort. The first thing we are going to do is scapular or shoulder blade movement. Scapular isolation lying on your back is a great place to start as it will help your shoulder movement. Lie down on your back with your knees bent and head rested. You may want to use a small pillow if it feels more comfortable for your head and neck. Holding onto a stick or an umbrella, lift the arms so that the hands are pointing towards the ceiling. See if you can feel the weight of your arms into the shoulder joint and take your attention to the back of the shoulders where you can feel the shoulder blades on the floor. As you inhale, reach the hands towards the ceiling as if you're trying to push the stick towards it. Your shoulder blades will separate and glide around the back of your ribs as you do this. As you exhale, relax the weight of your shoulders back towards the floor, feeling the weight of the arms into the shoulder joint and the shoulder blades flatten back to the floor. Try to only move as far as the shoulder blades go, rather than allowing the body to flex and extend. Repeat this up to 10 times. Assisted shoulder flexion is a perfect exercise if your shoulder range of movement is restricted after surgery or treatment. It can be useful as a warm-up as well as an ongoing stretch for your shoulders. All you need is somewhere to be on your back and a stick or your umbrella again. Lay on the floor with your knees bent and head comfortably rested. You can use a small pillow if this feels better for your head and neck. With your arms by your side, hold the stick with both hands. Using the happier side to assist you, lift the arms up and overhead as far as you feel comfortable. Some top tips for this include: try and think about the arm bones sinking into the shoulder joint all the way through the movement. Number 2 is keep the head heavy on the floor or the cushion. And number 3 is take note of what the rest of your body is doing and try to reduce the movement through your ribs and spine so you really focus on your shoulder movement. You can try this up to 10 times. Our next exercise is side lying movement. Use this exercise to get your arm moving well out to the side and overhead. This is a really important movement for things like putting on a coat. This exercise will work your shoulder muscles, but also the smaller stability muscles in your shoulder, the rotator cuff. These are vital for regaining full range of movement and for building strength. Lay on your side with your head supported, either by your underside arm or by a pillow. Rest your top arm on your side with your palm to your tummy and the elbow bent to around 90 degrees. Keeping the elbow on your waist, rotate from the shoulder, lifting the hand so the palm is facing forward and the fingers are towards the ceiling. Next, lift the arm up, maintaining that rotation whilst reaching overhead. Reverse the movement by bending the elbow and bringing it back to your waist, keeping the back of the hand pressing back to maintain that rotation. Finally, take the hand forward again to come back to rest on your tummy. Repeat up to 10 times, and you can try this each side. Our next movement is knee hovers. This is a great way to not only get your arms stronger, but also activate your core muscles as well. Set yourself up on all fours with the hands underneath the shoulders and the knees underneath the hips. Remember, you can make this a little bit easier if there is more weight in your legs, so simply sit back towards your heels. Aim to get your spine in its natural alignment. This will look different for everyone, but we aim to have those 3 natural curves that you would normally have in standing. As you breathe, press into the feet and hands and hover the knees off the floor a couple of inches. The spine and head should stay in the same alignment throughout. Try to take a deep breath in this position, then slowly lower back down to the floor. You can challenge yourself by trying to hold the position and see how many breaths you can manage whilst maintaining that posture. Repeat this up to 10 times, and if it's easy, simply increase the amount of time you are spending in the hover. Our next exercise is single arm weight bearing. Here, we are not only increasing the challenge for your shoulders, but we will be working your shoulder stability, core strength, and the strength whilst your arm is out to the side. Start on your side, propped up on your elbow and forearm, with the knees bent and almost in line with the hips. Firstly, practice activating the stability muscles in your shoulder by sagging down towards the floor with your ribs and then pressing into the floor so you lift out of the shoulder and waist, and the rib cage will lift towards the ceiling. This will help you to come into a diagonal line with your hips still on the floor. Next, release the press and sag back down towards the floor. Once you are happy with this, progress the movement by pressing into the forearm and the bottom leg to lift the hips up and away from the mat so you are hovering into a mini side plank. Repeat this up to 6 times on each side to begin with. Some top tips for this are: imagine you are pulling your elbow towards your knees when you lift the hips. This will help you to work the underside of your body. Number 2 is try and keep some of the weight into your legs so that you don't overload the upper body. And number 3 is see if you can maintain the neck alignment throughout so the head is in line with the spine. This means you will be looking at the world slightly diagonally.